I'm Dr. Aishvarya Kaushik from DBMCI MDS, and I have with me Dr. Rupinder, who has just cracked our NEET MDS exam with her proud father. Good evening, sir. First of all, I'll start with you. For everyone,
Good
guys,
evening, sir.
good evening, good evening. So I think today is the day when the reality sinks in. Initially, we don't even realize what has happened. I remember my time. Well, today we are going to talk about you, Dr. Rupinder. So, rank 41 in your very first attempt. So,
Yes,
first of
sir.
all, Rupinder, just I'll start with your dad. So, sir, how are you feeling as a father, as the support system to see her working hard?
आज इसका विषय रैंक आया है तो हमको देख के इतना बढ़िया लगा है बच्चे ने मेहनत की है और आपके इंस्टीट्यूशन ने बहुत बढ़िया मेहनत की है इसको पूरा पर स्टडी करी है आज चीज का इसको बेसिक बताया है आज चीज के लिए इसको बताया भी ऐसे इसको क्रैक किया जा सकता है उसका ही रिजल्ट है बेटी की मेहनत है ये अंदर की उसके साथ आपकी मेहनत भी है आपने पूरा पूरी ईमानदारी से इसको मेहनत कराई है ये उसी का रिजल्ट है
All your blessings, sir. So, Dr. Rupinder, tell us your journey. When did your internship end? After that, how did you start preparing? And where does DBMCI MDS come in? How it has helped you? Tell us your journey. Tell us from where you basically, when your internship ended.
So actually, it was always in my mind to do PG, and I started to do for it right after the final year.
Okay, so basically your preparation essentially started from the first day of internship. So that's one entire year that you
Yes, sir.
started studying. You had that orientation, that determination, that will that I have to do this.
Yes,
Great.
sir. Initially, sir, I used to think that कि 4 साल का syllabus इतना ज़्यादा है तो वो 1 साल में कैसे होगा वो भी at the level of competition. So, but sir, when I watched all the video lectures and gave all the tests, everything just came into the context.
So basically, our video lectures, both live and recorded, basically kind of knitted everything together. सब कुछ जोड़ दिया. Everything was correlated and kind of everything that was scattered, like 19 subjects which are scattered. You're saying
Exactly,
that
sir.
things started getting connected. You started correlating and you started enjoying
Yes,
the
sir.
subject. है ना? So
Exactly, sir.
tell us about your favorite faculties in DBMCI MDS.
So first of all, I would say that you, sir, Endocons is such a like ना subject है जिसमें values बहुत है and it is a very minute subject, endodontics. So sir, you made it very like one of my favorite.
Thank you. And what about dental materials? Dental materials is again a very big headache.
Material, sir, it is really, sir, it is like a headache, but sir, your video lecture, your notes, the way you summarized it in the video, it has helped me a lot to cope up with all of that.
Good. I think yes. And what about other faculties? Which other faculties you loved listening to, got motivated?
Himani ma'am was a great motivation. Like she is a great mentor. She's a great teacher. And Saurabh Bhatia sir, like anatomy sir, our and sir, like also like all the teachers, they were very good. Like they when I watched the video lectures, like each and every point, each and every topic they told us in detail. Like it never touched a book for my need.
Yeah.
I was totally on the notes.
Yeah, totally on the notes. The content was good. The delivery of lectures, okay, great. And what about connect with the student? How was continuous doubt solving? And obviously, as a student, you must be having certain questions which are like you feel that this is so easy. What if I ask sir or ma'am? So how was the connect? Did they answer promptly, immediately? How was the connect with you of the
So
faculty?
that I will especially appreciate all the staff members because sometimes I had such a small doubts. Like I used to feel कि यार ऐसे पूछेंगे तो मतलब गुस्सा तो नहीं हो
Gussa.
जाएंगे. But sir, but all the teachers like they told us very patiently. I would say that, and they used to decipher each and every point.
Yeah, and tell us during this entire journey. See, we have gone through this, so this journey can be frustrating. So now I would like to ask, sir, your father, कि बच्चे, सर कभी कभी बच्चे परेशान हो जाते हैं ना, पढ़ते पढ़ते फिर ऐसा लगता है कि कुछ नहीं होगा, परेशान हो जाते हैं, तो आप इनको किस तरह से ठीक रखते थे कि भाई जस्ट स्टे एट इट, यू विल डू वेल। और बच्चे बीच में क्या होता है, पढ़ते पढ़ते भूल जाते हैं। आई स्टिल रिमेम्बर माई फादर, वो मुझे सेंटर पे लेके जाते थे, तो गाड़ी में पीछे बैठा के लेके जाते थे कि वहां पे स्ट्रेस ना हो। बीच में हम पढ़ रहे हैं तो बीच में कभी केला दे दिया, कभी चाय दे दी। सो हाउ वाज दैट इज हाउ आवर पेरेंट्स सपोर्टेड
मेरे
अस।
इसमें यही है, कोई भी काम करना है, कोई भी स्टडी करनी है, जितने टाइम भी करना है, पूरा मन लगा के ये भी आपको 5 घंटे पढ़ना है, 5 घंटे की जगह आप 3 घंटे पढ़ो, चाहे 10 घंटे पढ़ना है तो आप 5 घंटे, लेकिन जब पढ़ो तो कब पढ़ो, जब
वेरी
आपका
गुड
अंदर
सर,
अगर
दिस
आपके अंदर भूख होगी तभी आप खाना खाओगे ना, जबरदस्ती तो खाना नहीं।
बिल्कुल ठीक।
हाँ, जो भूख इसके अंदर क्रिएट है इसने खुद की है। मैंने कहा ये इसको बोझ नहीं समझना, अगर लोड समझोगे तो आप नहीं पढ़ पाओगे। एंजॉय करना है, स्टडी को एंजॉय करो। अगर आदमी
टोटली
स्टडी को एंजॉय करेगा, कोई बिजनेस काम करता है, कोई सर्विस करता है, उसको एंजॉय करेगा ना तो मजा आता है काम करने में।
enjoying whatever you're doing. So, Dr. Rupinder, what sir
हाँ,
exactly said, ki, this brings me to the next question. How many hours? How many hours during internship after your posting, and how many hours after internship when you had your entire day and your entire night with you? कितने घंटे पढ़े?
During, sir, in the college, I managed to like study like 4 to 5 hours after the college, and during the college, when I had some time, like 1 or 2 hours, then I used to watch all the lecture video and make notes. And so when I came home after my college, I tried my best to give like 8 to 10 hours per day.
Okay, so after internship was completed, so where did you do your BDS from? You were
Sir,
in
I sir, I did it from Baba Jaswant Singh Dental College,
विद्या
Ludhiana.
Acha, so you were a hostler there, and then you came back home
Right.
after finishing the internship. Then you had your entire, day with you. Yes, so I think that is a great support system also. Khana pina sab parents dekh lete and you can concentrate
Yes,
on
sir.
study. So that is wonderful. So next, tell me, how did our grand tests help you in terms of, setting you up for the preparation, completing your course, and in terms of adding value to the level of questions, how well the questions kind of correlated with the actual questions that came in the exam regarding the grand
Uh,
test.
s- so first, I would say that no matter how much theory we read, until and unless we do not attempt the test, we are not even capable to sit in the NEET.
Exactly.
So, sir, when I gave my first GT, my marks was very less because after the first read, I did only the theory portion. And when I first sat in the GT, I came to know like the true about myself that I have not done these topics. So, I will say first that GTs are the true filter of your knowledge, that what you actually know and what you do not know. So I give many GTs and GTs were like only the NEET. They had the NEET question and if not the same pattern questions.
Yes. So basically, we would deliberately would want you to revise the previous year questions and also to keep you thinking by giving you new questions related to the previous year topics. That is
Yes,
always
sir.
the idea by while we are formulating the GT questions. So I think that is a great point that you've raised. That one is that you know the subject, but the other equally important art is to ultimately solve the question, because that
Yes,
is
sir.
to help you. So I
Exactly.
think in that sense, DBMCI MDS, I think, guided you well by, you had good enough time to study the subject also, but at the same time, put yourself to test
To
by
test, yes, sir.
giving repeated GTs and time management and solving questions. Wonderful.
Exactly, sir.
So tell us
Sir,
about our,
and the app also had, I would like to appreciate that the app gave us the same pattern of question like we were in, like they were in the NEET, like the time bound section they arranged for us, like in the
yes,
new pattern.
yes. And
That
how,
was very helpful.
okay. And towards the end, how did the Revision Pro videos help you?
Revision, sir, I would say that it is the one of the most crucial part of the journey because it is not only to read the syllabus, but we have to do it number of times. So, sir, their videos were able to summarize each and every point that was required to do in a short time. So they were actually very helpful after my first read of all the lecture notes.
So again, basically getting everything together and
Yes,
simplifying them and keeping everything in the head, right? So that you can attempt everything in those 3 hours and not get
yes, sir,
hassled.
exactly.
That's the idea. Okay, great. And the very often asked question, students keep asking me, sir, how many times do we need to revise the entire thing? It's not possible to do it 10 times.
Mm.
I always say this, there is no number. Revision is the most important thing. So try to revise as many times as possible. I think many a times, even whenever I've taken sometimes the morning motivation or whatever, I've always stressed on the fact that no number of revisions is sufficient. No number is sufficient for doing repeated revisions of your previous year questions, previous year papers.
Yes,
So
sir.
how many times, Dr. Rupinder, did you revise before sitting for the exam?
So actually, I did like in the minimum 4 to 5 times I did, and I would recommend that everybody to do minimum of 3 to 4 times, minimum, maximum as much as you can, but minimum, I would say 3 to 4 times.
Great. So 3 to 4 times. In fact, I always tell my students do it at least five. I mean, if possible, the tough things like dental materials or anything which is giving you confusion, try to do those topics and subjects at least 5 to 6 times. Or if you're not
Exactly,
able to
sir.
complete the entire content, then at least the questions related to them.
Yes,
Because
sir.
as I said,
Exactly.
no number of revisions is sufficient enough. So good evening, ma'am. So I think we have your mother also. Good evening, ma'am. Many congratulations to you. So today is the day to be. I mean, of course, you must have always been proud of your daughter, but today is a special day, isn't it? So yeah. So many
Congratulations to
congratulations to you.
the Dr. Bhatia, the whole institution, for
Thank you so
all
much.
their unconditional support. Anytime my child was in need, holding hands of the child and blessing her and
Yes.
giving her courage to come up to all the problems.
Thank you so much. In fact, I was discussing with Sir also, Dr. Rupinder's father, that children at this point of time, it's a very tricky, precarious time. They are they're under a lot of stress. They don't know. They're like, if we don't get selected, then what will we do? So I think all that stress management, absorption, that बच्चे परेशान हो जाते हैं बीच में तो उसको जो स्पॉन्ज की तरह absorb करना होता है, I think that all comes down to the parents, right? सो कैसे आपने डील किया पिछले 6-7 महीने में व्हेन डॉक्टर रुपिंदर केम बैक फ्रॉम हॉस्टल एंड कि अब मैं आ गई हूँ, नाउ इज द टाइम दैट आई जस्ट वांट टू स्टडी एंड बीच बीच में फ्रस्ट्रेशन होती होगी, सो हाउ डिड यू मैनेज एंड हाउ डिड यू कीप हर गोइंग?
In fact, sir, she had always been a very docile girl, as we were discussing earlier. She had never been a cranky. All the things since my childhood, I have trained her to do it yourself. Since you are in the school, you are in the college, it is your job to study, not our job. So she was already a trained child into this. She had an approach that yes, whatever I have to do, I have to do for myself. Not others can do my job. So she was already the mindset. Yes, gradually she had an appetite that yes, I have to go to the MDS. While she was doing BDS, she has decided and she was in that the institution. It is not always important how well you are doing it. It is also important that who are your gurus, who are your mentors that are holding your hands, telling you the right way, this is how you want to do. This is what has been done by the institution, and I think it is a blessing. Since it is not our subject, and I keep on asking her occasionally, Rupinder, are you think that you are benefiting from Dr. Bhatia's stuff material and the classes? She said, yes, Mama, of course, yes. They have given me a lot of concept clarity.
Great. So wonderful point. Thank you, ma'am. Regarding the fact that, okay, I'd just like to tell all the students in summary what ma'am has just said. First of all, you yourself have to be self-driven. Nobody can push you to do this because this is like a self-driven thing. It's not, your teachers can't scold you and make you stand in the corner like we used to, get through punishment. This is a self-driven thing, self-motivation if you want to crack these exams. That's one. And secondly, the kind of appreciation. Thank you, ma'am, for the institution. Apart from the continuous guidance, probably we've been able to provide, and it gives us immense happiness when actually results come the way they have come, and it's a wonderful feeling. I think for your very first attempt, Dr. Rupinder, it is a wonderful feeling, you know.
Thank you, sir.
You
Sir,
see,
it's actually
our country is a big country. I still remember 15 years back when I used to think about cracking these exams. You know, when you imagine the length and breadth of the country, we are a big country, and you feel how will we get a rank in the top 100? And if we don't get, then it's tough, isn't it, to get the subject of your choice? So tell us, what subject are you planning to take for your MDS? You got a very good rank. Whichever subject you want, you will get. Right? Of course, the college may vary. You might have to go far from your house or things like that. But which subject are you planning to take?
Sir, I'm planning to go for oral and maxillofacial surgery, and I always wanted to be an oral surgeon. But with this rank, I think I will be able to get my dream branch and my dream college. And all thanks to your team, sir.
Wonderful. It feels great, Dr. Rupinder. It's like our journey together, right? Because we are also very heavily invested in trying
Yes, sir.
to mentor you guys. So it is a wonderful feeling. Today is your day, and for a few days, just forget about everything else. I think you should not even read the newspaper. Just stop reading for a few days and just go out and enjoy.
She
And
never actually. She was not reading. She has kept away herself always.
great. Chalo, good. Wonderful. Thank you, ma'am. And thank you, sir. I think your father is probably taking a break and having tea. But wonderful, ma'am. Wonderful. Say thank you to your father. And blessings to you, Dr. Rupinder. Wonderful.
Thank you
Blessings to
so
you
much,
and
sir.
best wishes to you for a very bright
Thank
future.
you so much, sir.
Thank you. Take care. Right.